Well, hey, I'm Dr. Ben, founder of Well Health and Chiropractic. And if you are somebody who suffers from low back pain, disc bulges, herniated discs, arthritis, degeneration, maybe you've got a bad back, or you're thinking to yourself, man, I am too young to have this much issue, hang on tight, stay close. I'm going to teach you the mechanics of the spine because I focus my professional career on correcting spines and people, you name it, disc bulges, herniations, arthritis, we've seen all that stuff go away. So I'm going to show you what causes it so we can show you what we need to do to fix it. So first and foremost, what in the world are the discs in your back, the bones, how does that work? Well, you have 5 lumbar vertebrae. Now I've only got 4 of them drawn up here because it's easier that way. But you have 5 lumbar vertebrae, and obviously those bones are solid. In between those vertebrae are the discs, right? So the black ones are the bones. In between them are the discs, right? The blue are discs. So that is going to be basically a thick piece of cartilage is what a disc is. In the middle of that cartilage is what's called a nucleus pulposus, which is what the red thing is there. And that is the jelly in the jelly donut. If you've ever heard that in the disc, but that's the jelly. That's a really cool way that God made your body, that your vertebra can move, and actually it allows your vertebra to move and that disc to stay flexible. That jelly can move around, and it's really an ingenious way of how our body's designed. So that's such a big deal because when we have the nice normal curve in our back, again, this is normal. So this is someone who's facing this way. We should have this reverse curve in our low back. That is normal. There will be absolutely no abnormal pressure on that nucleus. The problem is when our disc or when our back does this, we have whiplash, back injury, maybe we go to pick up something really heavy, we hear that pop, we lose that curve in our back. What that does is that winds up taking that nucleus and shoving it backwards. And that is what a disc bulge, disc herniation is. I'm going to talk about that here in a second. Now, as we talk about this, do know that this is the same thing as a neck disc bulge or herniation. So in your neck, you should have this reverse curve like this. And when we get into a whiplash situation, it winds up shooting that disc backwards or the nucleus backwards. Now, so that's what this looks like. But the reason this is such a big deal is because behind here, ready for this? This is where your spinal cord lives, okay? Your spinal cord lives right here. As a matter of fact, it's so close it's nearly touching these vertebrae. And when these discs herniate backwards, they actually wind up touching that spinal cord if they go far enough. That's a real problem. That's when you really start to get your sciatics, your legs going numb. Actually, it could go to the side, and these nerves, these wind up being these nerves that go out to your legs, your feet. And when that disc bulges and herniates, pushes on that nerve, we're going to see lots of sciatic issues. So that's physiologically, that's the problem. So what about these discs? How does this happen? So your discs are made of a bunch of annular fibers, a bunch of concentric circles basically. And what those fibers are, that's how God made your discs to be so stable, is they wind up being little rings of fiber. And in the middle of that, of course, is your jelly for the jelly donut. We call that nucleus pulposus. So as we initially get these injuries, what happens is that our nucleus winds up shoving backwards. Now people say like, man, it must have been a terrible design of the body. If you pick something up, you're going to have an issue. Well, the reality is that God gave us a great body. When our vertebrae are in the right position, we got the nice curve in our spine, our vertebrae are straight, research shows that you compress the spine so hard that you will explode the bone before you explode the disc, because your discs are that tough. The problem is when the vertebrae shift out of position, now you're putting abnormal load on that disc, and you are breaking it down, and that's when you get the herniation. That's when you can bend over to pick up a sock and blow out your back. And that's really what we're talking about here. So this is going to be what we call a normal disc. The first thing that can go wrong here is when this nucleus shoves backwards, it winds up ripping and tearing the annular fibers. We call that a disc bulge, okay? And why that's a disc bulge, it rips those fibers and it winds up taking the edge of your disc, which by the way is a hard piece of cartilage, and shoves it backwards. So it takes the edge of that disc, I'm going to use this one, and it shoves it back into either the spinal cord or the nerves going to the legs. That's a real problem. Also, these annular fibers have specific nerve fibers, and it hurts like crazy. You're going to feel that, and that's actually like acute. You'll be on the ground laying there. A lot of people that just get disc bulges think that that's a herniated disc, and it's generally going to be a bulge, okay? I'll just put this up here so we don't forget it, okay? And this is going to be normal. All right, the second thing that can happen is a disc herniation, right? So what a herniation means is that this nucleus actually goes so far that it rips out into that space. So what happens here is it's going to be more like this top one where this disc comes all the way out, that physically that nucleus material winds up touching the nerve or the spinal cord. Now we call this a herniation. Okay, a disc herniation, a herniated disc. Now, the ironic part is a disc bulge actually hurts worse because the edge of this disc is actually cartilage, and when cartilage jams on a nerve, it hurts like crazy. When this soft nucleus touches up on the spinal cord of the nerve, it actually doesn't hurt as bad. It's not friendly and fun, but it's not as bad. The third type of disc injury here is going to be what's called a sequestration. And basically that means that this is torn all the way through here, but we've got a piece of this nucleus that's now on the other side completely. It's usually a little fragment hanging out there, and it's ripped through here, but it's not connected anymore. Okay, and we call that a Okay, that's a sequestrated disc. Now, again, that's going to be where you have some of this disc material just kind of hanging out over here. Now, which one of these is worse? That's the big question. Which one's worse and how do we fix it, right? The one that's worse is, you ready for this? They're all about the same. This one hurts worse. This one actually takes longer to heal. This one, within 6 weeks, that thing is absorbed and it's gone. The problem here is, and the answer is they're all bad. You don't want any of them, but they all can be fixed. So with a disc bulge, the beautiful part is this is the one that takes 6 weeks. It's going to hurt like crazy. When you get it adjusted, it'll shove right back in there, and this thing can heal up almost 100% healed, and that's fine. It's more about the healing. This one's better. The herniation, we can get that to suck back in, and it can close itself back up, and it can heal, and that'll be fine. The sequestration, the problem with this one is we can actually get this to restore the mechanics here, but because this disc material is out, is going to get resorbed by your body, you're never going to get that back. So your disc height is going to be smaller permanently. But the most important thing here is to fix the biomechanical problem. Because when you're in this, when you have a nice good curve in your spine, every time you walk, spring, 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 normal. When your neck or your low back does this, every time you walk, jam, jam, jam. That's what causes the herniation. So the big thing is how do we fix that? Well, I'm a corrective chiropractor, and the techniques that we use in this office are amazing. We've literally seen probably 3,000 or 4,000 people with herniated discs of some fashion get better, and get better very quick. So what we do is we have to first, we palpate the spine so we can feel where the vertebrae are. Then we shoot a very specific set of x-rays. Those x-rays allow us to see the position of your vertebra, whether there's arthritis, injury, stability, all that. From there, we then will adjust the spine. So if the vertebra in the wrong position, we move them in the right position. And the most important thing is we work on the muscles, ligaments, and tendons to re-stabilize the spine. Because the number one thing that you want in your low back is a stable lumbar spine. So that's what we do to fix that. Now, when you do that, you don't want just any type of adjustment. You want a very specific corrective adjustment. It has to be powerful enough to move the vertebra.